Come in.
Good morning, Mrs. Wilson.
Good morning. How are you?
I'm good. I'm Brianna.
I'm Nicole. Nice to meet you.
Nice to meet you. Before you begin, do you want me to call you Mrs. Wilson or Nicole?
Nicole's fine.
Okay. So today what we're going to be doing is I'm just going to do a health assessment on your skin. And I just have a few questions to ask you. Before we begin, is there anything you want to ask or no?
No, I don't think so right now.
Okay. All right. So let's just go ahead and begin.
Okay.
So do you have any past history of skin disease or problems?
I do have a history of eczema,
Okay.
but other than that, no.
All right. When you had eczema, how was it treated?
I use a topical steroid cream that was prescribed to me by a doctor. I use it probably just every once in a while when I need it, and then lotion just to keep my skin hydrated.
Okay. Do you have any family history of allergies or allergic skin issues?
My brother has asthma.
Okay.
But other than that, nothing other than that. My grandma had eczema on my mother's side.
Okay.
But no.
All right. Do you have any known allergies to drugs, plants, or animals that may cause your eczema to flare up from time to time?
No known allergies to anything like that, no.
Okay. Do you have any birthmarks or tattoos?
I do have a birthmark right here on my hairline, but no tattoos.
Okay. So with your birthmark, does eczema ever flare up around there, or?
No.
Okay. Good. So do you have any excessive dryness or moisture that you notice with your eczema?
It occurs when my skin's really dry, in my opinion, but no excessive moisture, no.
Okay. Do you feel any kind of like noticeable changes in your skin, like scaly or rubbery, anything?
Well, when I have an eczema flare up, the area that has got eczema on it is scaly and just kind of gross. But no excess moisture, no.
Okay. Do you notice it more with the winter or the summer or spring?
Definitely in the winter when it starts getting a little bit drier, I feel like it gets worse.
Okay. Does it get better as the summer or spring comes near?
Yeah. I mean, it's kind of something I have to deal with all the time, but I feel like it's a little bit better when it's not so dry and there's a little bit of humidity in the air.
Okay.
Mm-hmm.
Do you ever have like excessive skin itching or burning?
Only when I have eczema, it does itch, but in areas that don't have eczema, then no.
Can you describe the itch?
It can be pretty intense, but just is itchy. Like maybe like poison oak kind of is a good relative term.
Similar.
Yeah.
Okay. Does it ever awake you in your sleep?
When I was younger, it used to a lot. Sometimes if I have a bad spot, it will, but not often.
Okay. Do you have any other like skin areas that bother you that will kind of cause you to have that similar itch or wake you up?
Nothing similar to that. I mean.
Okay. So with your skin rashes, do you notice when they come on or how long they last?
Yeah, I mean, I've had a spot on the back of my calf for a little while, and it's been about a month. It's a little bit longer than normal, but I've been kind of lax on putting my prescription medicine on it.
Mm-hmm.
So that's probably why I need to stay on top of it. And putting lotion on when I get out of the shower. If I don't do that, then I notice I'll have an issue. But
okay. And then, where do you notice it start? Like, does it spread anytime?
It usually, it doesn't really spread. It's, right now, what I do have is just that one little spot, and it's pretty in a tight little, just like a circle on the back of my calf, almost.
Okay. Is there any, certain kind of quality that goes with it, or any kind of characteristics that you can think of?
Well, now, it's more of, adult eczema, which isn't as, when I was younger, it was really gooey and gross and oozy, and now it's just kind of really dry skin.
Okay.
That's pretty much what it looks like.
Okay. Do you have any cracks or any kind of ooey?
No. I don't really have any skin breakage unless I itch it to the point where I break the skin with my nails, but it doesn't crack on its own or anything like that.
Okay. And then, do you notice anybody at home or work who has a similar rash?
No. I haven't noticed a new one.
And then, do you have any kind of like alleviating factors that help make it feel better?
Definitely like lotion, or if it's really itchy, putting some ice on it helps. And then obviously the use of my medication actually makes it a little bit itchier when I put the Protoptic on or the steroid cream, but it helps get it to go away faster. So if I can put it on and kind of like wait it out, it's good.
Okay. So an aggravating factor, besides the topical cream, do you have anything else that aggravates it?
Definitely heat. Like I said, dryness and like when it's really dry in the winter. But other than that, if I try to stay away from like perfumed lotions and like really perfumey like body soaps and stuff like that, because I have noticed that it can have an issue with my eczema.
Okay. Okay. What kind of issues does it cause?
I feel like it just causes my skin to dry out faster, and when my skin dries out, then I have the problems with the eczema, so I just kind of stay away from them.
Okay. Do you ever experience any kind of like burning with that?
No, it doesn't burn or anything. I feel like the alcohols in it that make it smell just kind of dry my skin out.
Right. Okay. And I just have a few more questions, and then we can be done.
Okay.
So in regards to your medications, can you be specific about what kind you take?
Like I said, it's called Protoptic, and it's like a 0.01% steroid cream. I don't really know the generic steroid that's in it, but yeah, Protoptic is the name of it.
Okay, thank you. Do you take any like over-the-counter medications to help alleviate the pain?
Like I said, lotions. I have used like anti-itch cream sometimes if I don't want to keep putting the steroid cream like overlapping it over and over again. I have done that just to relieve the itch. But other than that, no.
Okay. And then last question, what do you do for your skin and your hair and your nails?
Like I said, I do use lotion, and I do try to stick with shampoos and body washes that are like allergen free or sulfate free or anything that has anything harsh in it. But other than that, nothing too specific.
Okay. Since we're in a harsh climate with the winter, what do you do to help with your environment to minimize your exposure?
I do have a humidifier for the winter to put a little bit extra moisture in the air in the house. Like I said, lotion, that's pretty much all you can do, and the medication.
Okay. And then do you ever perform like a skin self-examination?
Honestly, no. I mean, if I have an issue with my skin, obviously I look at it, but I'm not proactive about it.
Okay. Well, that seems to conclude all my questions. Do you have any questions regarding our interview?
No. It's very nice to meet you. Thank you.
It's very nice to meet you. I really hope to see you again.
Yeah, you too.
All right, have a great day.